Thank you very much for inviting me here this morning. It's a great privilege to come down and speak to you. So just to start off with a wee bit of where we're based. So we're based in Coleraine, which is about an hour north of Belfast. And this is what it looks like on a lovely summer's day, but I've been led to believe that when I go home today, it'll maybe just not look as calm as this. And these are some of my colleagues who I work with in Niche. And really, within Niche, which is the Northern Ireland Centre for Food and Health, we work under different research arms. And I'm based in this one here, which is with Professor Barbara Livingstone, if you're familiar with that name. But there are 7 research areas, all of which are publishing research in the area. So today, as I've been introduced, I'm going to speak about maternal obesity and the link between maternal obesity and retaining weight after pregnancy, and that's really what I want to talk to you about today. So I'm going to cover some of the incidents and the facts in relation to childbearing and the figures in relation to obesity, maternal obesity itself, and then obviously gestational weight gain is an important part of that, and then following on with weight retention and then some take-home messages for you. So it is important to realise that childbearing years are an important life stage, and I know recently it's got a lot of publicity in relation to the amount of people who are obese entering into pregnancy, but it is an important life stage because we hear a lot about obesity in children, and obesity is various different other life stages. So this is an important life stage as well. As you know, obesity is increasing worldwide, and they're obviously within the general population, and then obviously these people are entering obesity, so the incidence is increasing. The CMAC report, which was a report in a UK based, they looked at the figures and those figures were up to about 2002, and they had indicated that there was a big increase in ladies of childbearing age. And as we can see, more women than ever before are obese at the start of pregnancy. And not only that, more women are actually gaining more weight during pregnancy as well. So that's the 2 key things that I'm going to talk about today. Okay, so there have been quite a few systematic reviews and obviously research within the area, and this one really just highlights the importance of the association between gaining weight during pregnancy. If you have one baby, then you gain some weight. Then if you have a second baby, you gain more weight, and don't go back to your pre-pregnancy weight. And then eventually, you know, you are heavier after you've had your family, and then you don't lose that weight. So this is a systematic review that alludes to the issues in relation to weight retention postnatally. So this slide here is indicating the numbers of ladies who are obese in the childbearing age, not necessarily pregnant. And you can see that there is an increase over the years. This is a publication by Hazelhurst, who's in the UK in Middlesbrough, and she had done some work on this, and she indicated that there was a big increase in the numbers of ladies becoming overweight and then entering into childbirth, and you can see that it's increasing over the years. And I was looking for figures to do with the south of Ireland, obviously, and I came across this, which was indicating that there's a 43% of pregnant women are overweight or obese, and that was from a hospital here in Dublin. So that's quite a high incidence. And if you compare that to figures that we have in the north, and some of the PhD students who I work with have produced some of these figures, which aren't published at the minute, in the red, and the green is a review of a database really of pregnant ladies who enter into hospitals within the north of Ireland, and they have looked at the numbers of people who are pregnant. So that was the publication there in the green, and you can see that the sample that we have from research purposes is much the same as the sample there, which was captured through the databases, which is an IMAS database, which captures those ladies that enter hospital. And you can see that there's about 40%, if you look at those 2 columns, between the overweight and the obese. And scaringly enough, the incidence of those that are morbidly obese is increasing as well. So these ones here is the ones I'm referring to. So if you add these columns and these ones here, it's a roughly 40% as well. So I suppose that's comforting to know that what's happening in the south of Ireland, in the one that I reported there from Coombe Hospital, is much the same as what's happening in the north of Ireland, and then that is related also to the UK as well. So when you actually are pregnant, then this slide relates to those people that are actually pregnant. And pregnancy has been identified as the only natural physiological process whereby a woman's body weight increases by about 20% or more, and it's a life stage obviously where there's significant weight is gained. That doesn't necessarily mean to say that you need to retain the 20%, but people entering pregnancy must realise that they are going to gain weight during that time. So the contribution of pregnancy to development of weight gain and obesity has important implications for the mother, as we will see, but also for the offspring, and that's important to know as well. Body weight before pregnancy can affect the mother's health and pregnancy outcome, as I've alluded to, and overweight or obese are more likely to experience some medical difficulties and delivery complications. And usually when we're talking about high risk ladies, we're talking about a BMI over 30, and they would be referred to in the NICE guidelines as being an at-risk group. But it is important to know that if you looked at the figures, there's a significantly large number of people with a BMI greater than 30, and the health service just doesn't have the capacity to cope with those numbers. So usually interventions and some kinds of help is only given to those ladies maybe with a BMI over 40. Some cases it's over 35, but quite often it's over 40. So this slide here just indicates some of the issues to do with maternal obesity, and gestational diabetes is one of the big issues which can arise when somebody is overweight. It usually doesn't appear until about 28 weeks pregnant, but it is a big issue, and this is one of the issues here. There's new criteria for development, new criteria for diagnosis of gestational diabetes, and they've noticed that the incidence of gestational diabetes has increased dramatically, and this is likely to be a cause because of the increased numbers of people who are obese. So gestational diabetes is a big issue. Preeclampsia, which is like high blood pressure, is also an issue, and there is evidence to suggest that if they do lose weight, that there's a chance that the preeclampsia won't be just as common. There's also issues to do with miscarriage and stillbirth, and that sometimes prevents some of these overweight ladies becoming pregnant to start off with. Large babies, this refers to large babies over 4 kilograms being born. It's also very well known now that people who are obese entering pregnancy are required to take additional folic acid, and this is one of the reasons why, because of the higher risk of birth defects in this population. There are also delivery complications, and if you speak to any midwives, they will tell you that they have to be well prepared for these ladies. They have to have blood pressure cuffs which are larger, they have to have larger trolleys for these ladies in delivery suite, etc., etc. So there's lots of complications from a practical point of view, and then obviously there's the complications when the babies are born. Clotting can be an issue too, and I have alluded to the fact that the children that are born can often be heavy at birth and carry on with that adiposity later on, and obviously postnatal depression linked to the obesity. So there's a lot of complications for those people who are entering pregnancy who are obese. And then if we look now at the weight gain during pregnancy, so evidence would suggest that people who are entering pregnancy should gain a certain amount of weight, and not always do people stick to those limits or those recommendations. So approximately 33% of women have gestational weight gain higher than the recommended. Ideal gestational weight gain recommendations are dependent on pre-pregnancy BMI, and it would suggest that those that are entering who are already overweight or obese tend to gain more weight during pregnancy. So women who gain above those recommendations, as I say, are more likely to be overweight or obese, and women who have gained higher amounts of gestational weight during pregnancy, evidence would suggest that they're more likely to retain that weight at a year. So if they're gaining too much weight during pregnancy, they're also overweight to start off with, the evidence would suggest that those are the ladies that we should be targeting because they're more likely to retain this weight afterwards. And at the bottom here, it is important to realise that the number of pregnancies that the lady has is important as well, and this contributes to obesity at 5 years, when research would suggest that the more babies they have at 5 years, or after they finish the families at 5 years, they're more likely to be heavier than those ladies who have only had 1 or 2 children. Okay, and this is just putting those two slides together so that the ladies that are overweight coming into pregnancy, and then also those that are gaining too much weight during pregnancy, these are the issues that we have here. So obviously we have issues with the mother's health, which we've alluded to. We have issues with the healthcare system, and obviously the cost of all the extra resources. And then obviously we have to think about the neonate itself and the issues in relation to that. So in relation to weight gain then, certainly in Northern Ireland and in the UK, there are no weight gain guidelines that are used routinely. The only weight gain guidelines are American, and these have been published in 2009. It is a controversial area in the UK in that pregnant ladies are not routinely weighed during pregnancy, and therefore it's very hard to see how much weight they're actually gaining. But this is the American guidelines are referred to in the literature, and that's why it's important to mention these today. So these American guidelines, IOM guidelines, would suggest that depending on your pre-pregnancy weight, would indicate how much weight you should be gaining during pregnancy. And you can see here that the obese ladies should actually be gaining a lot less than obviously the underweight. So it depends very much on their weight when they're entering pregnancy as to how much they should gain. And just for those that maybe don't work in the area, the weight of a normal baby when it's born is about 3.4 kilos, and overall the total weight gain a mother should be expecting to gain is about 12.5 kilos. So all in all, that is roughly the amount of weight that you should be gaining. But if I just go back to the previous slide, you'll notice that the obese ladies are being encouraged to gain a lot less than what the textbooks and what the literature would say that is required. And I think for this reason, it's important to note that it's hard to adhere to those guidelines, especially in the UK, when obese ladies are not being told and not being encouraged to gain that weight. But even if you look at the literature in the US, where these guidelines are being implemented and people are being recommended, you can see that a large numbers of obese ladies are not actually adhering to those guidelines. And this is just some data that we have looked at in some of the PhD students that I have. Again, these ladies are all from the Belfast Trust, and they've been followed up as part of a research study, which is a HAPO research study. And we have access to the data, and we've looked at this. So there's about 1,600 ladies in this sample. And you can see here that when we looked at their weights, so we looked at their weights and their weight gain. Obviously we had to classify these ladies into their BMI first. So their booking BMI, we classified them, and then we looked at how much weight they had gained. And you can see that the overweight and the obese are obviously gaining in excess of what those recommendations would suggest. And that is one of the reasons why it's controversial in the UK and why these guidelines haven't been adapted by all the trusts, really. So it is important then to realise that if you gain too much weight during pregnancy and you're obese to start off with, sometimes you can be obese, gain too much weight, sometimes you can be normal weight and gain too much weight. But regardless of those, both of those are risk factors for retaining weight after pregnancy. Excess adiposity contributes to the problem of postpartum weight retention. And I suppose the important thing to mention about this is that if you're looking at the literature in relation to postpartum weight retention, some studies refer to having lost your weight within 6 months after having the baby. Some refer to it as 12 months. So there's no real set time as to when you should be losing your weight or what the postpartum period is referred to. So therefore, most people would use a proxy of 12 months that they should be getting back to their normal weight at that stage. So at 6 weeks then, this is the stage when midwives would believe that the blood volume and the uterus have returned to normal and that things should be kind of progressing in relation to your weight. But about 2/3 of women at this 6 week stage are still on average a lot heavier than they had been before pregnancy, 3 to 7 kilograms heavier. Many women don't realise that their body weight during this time affects their future health. They don't really think about the fact and the impact of the pregnancy and not getting back to their normal weight. I think sometimes what happens is that pregnant women have one child, they know they need to lose a wee bit more weight, but they think, oh, well, I'm going to have another baby in the next couple of years, so I'll worry about that after the second one's born. And I think that's how sometimes people don't realise that body weight is important. And also midwives are so busy within these clinics that they don't necessarily have time to talk to ladies about this kind of information. So pre-pregnancy BMI is the strongest predictor of excess gestational weight gain and future obesity, and weight management needs to occur in the period in between the pregnancies to try and make sure that they get back to their normal pre-pregnancy weight instead of just accumulating weight over time. This slide really shows some of the follow-up studies which have taken place in relation to postpartum, and some of the studies are a lot longer obviously than others. And you can see here that all of these studies would suggest that excess pregnancy weight gain and failure to lose weight are indicators of obesity in later life. And each of these studies here would provide evidence for that. So I think that's a key message, that it is important to highlight to pregnant women the importance of pregnancy and making sure that they do try to lose the weight at that stage. So weight retention after pregnancy then, so there are issues with this obviously. So you've got your weight retention here, and evidence would suggest that most people 5 years after having their last baby would be about 6 kilos heavier than their pre-pregnancy weight. And this is obviously an economic burden, and if you think of obesity in the future, this would lead to the development, as I say, of gestational diabetes when they're pregnant, but diabetes, cardiovascular disease, and all the risks that I'm sure you're very familiar with when you're speaking about obesity generally. And obviously that's the mother's health there. So this slide here again relates to some of the figures that we have produced from some of the, this is the 1,600 ladies we were speaking about. And although we don't have data at 1 year, so we have their weight at in pregnancy, and sometimes it's very hard to get their booking weight, in fairness, because some of these ladies don't have weights exactly recorded, and these weights here, so I've used a weight of less than 16 weeks, which the literature would suggest is a reasonable weight to include as a pre-pregnancy weight. So all these ladies had a weight here in pregnancy between roughly 8 weeks and 16 weeks, but if they're over the 16 weeks, they're excluded from this slide. We didn't bring these ladies back at 1 year, so we don't know what they were doing at 1 year, but we did bring them back at 2 years, and we did bring them back at 6 years, and they're currently being followed up at 10 years. And you can see here, the blue line is the underweight and the normal weight and the overweight, and this was, they were classified like this at their booking. And the obese, and you can see that the bottom, these three here, the underweight, normal weight and overweight, are all gaining weight after 6 years, so they all have gained weight, although these are the averages of the 1,600 ladies now, so there's obviously some differences, you know, some have lost, some have gained, but these are the averages, so you can see that the averages have increased, except, interesting enough, for the obese. And I think this is very interesting because they've obviously gained weight up to the 2 years, and then after that they have maybe had more intervention, more information, or maybe they've decided that it's time to do something about it. So I think that's quite interesting. But interestingly enough, these three groups here are the ones that are continuing to gain weight, and it will be interesting to look at the 10-year to see if that's still an upward trend, and hopefully the obesity, the ones that are obese, maybe come down. So remembering that my remit today was nutrition, I felt it was important to have a wee look at the diet of these ladies. And we looked at the diet during pregnancy, and then we looked at the diet in 6 years, at the 6 years. And you can see here that, that in pregnancy they're eating more than they are 6 years postnatally, which is interesting in itself. Because during pregnancy you are usually encouraged to eat a little bit extra, not an awful lot extra, but a little bit extra. There could be issues here with underreporting, obviously. There could be issues with the methodology used, because they were taken from food frequency questionnaires. So this is just preliminary data which we're trying to investigate at the minute. But it is interesting to see that they've reported eating more during pregnancy than they did 6 years postnatally. And if you looked at the previous slide, you can see that they're actually putting on weight postnatally, but they weren't, they've been putting on weight. So I think that's quite interesting. The rest of the nutrients there wasn't really very much difference between them in relation to the content, in relation to the fibre. There was a little bit of difference, but not really very much else. This one here then, we looked at those that gained weight. So we looked at those that gained weight during pregnancy, and then we looked at their diet in relation to that. And over here we have the weight retention. So that's the amount of weight that they gained at the 6 years in relation to their diet. You can see there were some differences in their diet here for gestational weight gain. So those people that gained more weight during pregnancy, according to our results, would seem to be have differences in the sugars and the fibre and the glycemic load compared to the others. And in the weight retention, for those that gained weight over the 6 years, there wasn't really very much difference at all in that. So as I say, this is preliminary data and we are going back to explore it. But I would imagine that these probably won't be that important for the gestational weight gain, because I would imagine they're going to come out quite insignificant, really. I think interesting from this slide then, so we looked at those factors which influence weight retention at 2 years and then at the 6 years. And interesting, this morning on the television I was watching in the hotel, it was mentioning the fact that breastfeeding, and if you did breastfeed, you were more likely to lose your weight. And I thought that was quite interesting, because we noticed here that those that breastfed that doesn't mean they breastfed for 2 years and 6 years. It means that they breastfed at birth, obviously, and then we were looking at the 2 year and then we were looking at the 6 year, and we didn't notice any difference at the 2 years from those that did breastfeed at birth. But however, we did notice at the 6 years that there was a difference. However, that is likely to be related to the general picture that breastfeeding people are more likely to be healthier, they're more likely to be having a healthier diet, those kind of things. Again, as I say, this is preliminary data. In terms of smoking, again, there was no difference at 2 years, but there was at 6 years. And the previous pregnancies, obviously I've already alluded to that, the previous pregnancies, we noticed that there was a difference at 2 years, however, there wasn't at the 6 years. So just interesting to note that that's some of the preliminary data. We then decided to look at some of the dietary patterns. So when you have the foods, you can put foods, the data that we had was taken from food frequency questionnaires, and then we assessed the nutrients through QBuilder, which gives you nutrients. But you can also look at dietary patterns based on the information that's provided. So we looked at that, and that we tried to look at the dietary patterns in relation to the healthy dietary patterns, and we found that there was higher scores, which you would probably expect. So a more healthier diet from those from a higher socio-economic class with higher education, marriage and age, as opposed to the lower socio-economic groups which weren't having the good pattern. And that's really the reverse of the previous one, which shows that the processed and confectionery was higher in the lower socio-economic classes and lower education. So that's probably what you would really expect. So if we look at the offspring, then it is important to think about the offspring. And as I started out by saying, it's more likely that if you have an overweight lady who's having a baby and then they gain too much weight during pregnancy, that the offspring is likely to be heavy, and there's a chance that that baby will develop obesity later on. So the contribution of pregnancy to the development of weight gain and obesity has important implications for the mother, but also for the offspring. And sometimes I think that message doesn't always get through to the pregnant ladies, and they don't realise that they're impacting on the offspring as well. The offspring of obese mothers are more likely to gain more weight in childhood and into early adulthood, and then that becomes some of the obese children, the childhood obesity that we hear about. Offsprings of those who gain excess gestational weight are also more likely to gain more weight in childhood and into adulthood. So regardless if the mother is overweight or obese at the beginning of pregnancy, or regardless of the amount of weight that they're gaining during pregnancy, both of those can contribute to childhood obesity. And again, there are quite a few systematic reviews in the area, and this is just one that would suggest that there is a link between the weight gain in this case, which this one's reviewed, and the risk of obesity in children. So the key thing here to note is that it seems to be an obesity cycle. As we know, the incidence of obesity is rising generally, and then because it's rising, then we have more ladies entering pregnancy who are overweight or obese. They are gaining more weight during pregnancy as well, and therefore this is potentially altering their future weight and their weight retention, and then that develops then into heavier babies and heavier children in the long term. So we can see it's like an obesity cycle where it just continues to go. So the causes of obesity, which is linked into that then, I've taken this from the Foresight report here, which I'm sure you're all familiar with, and they would suggest that there are 7 causes for obesity which are linked to activity and food consumption, genetics and social influences. But the next slide I think is important as well, because obviously I'm speaking about pregnancy. So although those are the reasons generally for obesity, it is important to focus on the pregnant lady, and there are additional reasons why a pregnant lady may become overweight before or gain too much weight. So obviously a poor diet, that goes without saying, and there can be lots of reasons why they have a poor diet. There's always this thing that they're eating for two, and maybe it's a myth. Maybe it's something that they want to think that is a real life issue. So there is an issue around what they believe and what they think. There is an issue around inactivity as well, and sometimes when people are pregnant they do have some complications, for example back problems, joint problems, etc., which maybe prevent them becoming more active or doing what they would have done before. There's also the other issue that they don't want to lose the baby, and there's issues around being too active and maybe having miscarriages, and then obviously there's the bulk and the size of the person which maybe prevents them. So there's a lot of issues around inactivity apart from just not wanting to do it. Maternal complications, obviously that links into the back problems, those kind of issues, but there can be other issues as well, things like sickness or heartburn or other kinds of issues which can sometimes prevent people from eating a healthier diet or participating in activity. Food cravings I haven't mentioned a lot about, but that's one of the things that about 40 or 50% of pregnant women would admit to having, and many of these food cravings would be linked to sugary foods or chocolate or some of those kind of foods, which maybe doesn't help. There is a lack of understanding of diet, possibly in relation to how important it is for the mother to understand what she's eating, and obviously the benefits to the child, and just the whole labelling issue and lots of issues around that. And obviously the mother's pre-pregnancy BMI is important as well, and maybe if she's overweight then she doesn't feel it's the right time to be thinking about what she's eating. So there's lots of issues which can be related to why the person becomes overweight during pregnancy, as well as those obviously which we've identified from the Foresight report. So then why do women fail to eat healthily and exercise during pregnancy, and how can we motivate these women to exercise and eat healthily during pregnancy? And this was another PhD student was looking at this area, and she felt that it was a teachable moment for pregnancy, and this is a good paper here which suggests that in pregnancy people are more likely to change their diets, they're more likely to be receptive of new information, they're more likely to be going to health professionals and reading on the internet, etc. about pregnancy, because they realise that they are pregnant and they want the best for their baby. So pregnancy is a good time in the lifespan to be trying to teach pregnant women about what they should be eating, and obviously then that will have an impact on the child as well, and the whole family generally. And the student that I'm speaking about did a systematic review looking at goal settings. So what she was doing was she was trying to look at how motivated these people were and maybe give them different goals and different strategies for trying to think more about their diets. So more personalised information was what she was looking at. And I suppose if we read some of these, which she took from focus groups, you can see that the midwife obviously is trying to give information to the pregnant lady, but the pregnant lady's just not in the right place to take this information on. So for example, the pregnant lady's all I could eat was white toast and nothing else for the first 10 weeks. However, the midwife's busy telling her that she needs to eat green vegetables and fibre. So you can see there's a mismatch of information, and it's really just because the midwife has probably only got one opportunity to see this lady. She has so much information to give the lady at that time, and she feels that's appropriate. However, I suppose when you look at all this here, that's why it's much better to have maybe more personalised information for the person, and maybe even more technology involved where some of this information could be put, and instead of the midwife taking time going through all these issues with her, it might be more appropriate for her to signpost her to appropriate websites or appropriate links where she could maybe get the information that she needs. So all too often we assume that because we're seeing these people, we need to give them all of the information at that time, but that's maybe just not the right way. Then another PhD student I had was looking at the barriers to healthy eating. So at 6 months, she looked at during pregnancy, after pregnancy, and then at 6 months, what would the barriers be to healthy eating. And we had recruited some overweight and obese ladies and some normal ladies. And you can see that there is differences. We've circled the ones that are most obviously different in red. And you can see that there are different barriers between those people who are normal weight and those people who are overweight or obese, between why they're choosing to eat certain foods and why they're possibly remaining overweight. And the motivators as well for eating at 6 months. And it would seem that the overweight or obese people have more emotional eating patterns, certainly at 6 months, than the normal weight ones. And they're more likely to crave certain foods or eat foods in response to emotional cues instead of looking at some of the nutrition or the taste, those kind of things. So I think that's important to realise as well, that if you are looking at overweight or obese people, they again have different ways of coping with food, and we need to have different strategies in a way of trying to encourage these ladies to maybe think more positively about what they're eating. And I know I'm supposed to be talking about nutrition today, but I do feel it's important to mention exercise. And if you look at any of the systematic reviews in relation to how best to try and encourage overweight or obese ladies to lose weight, it's all about a combination of diet and physical activity. And a Cochrane review very nicely suggested that that's the way forward. So this here would suggest here, again I've taken this from the Irish Medical Times, suggests that Irish people exercise less than Americans. Now I couldn't find any information specifically on pregnancy, but this is what would be suggested. Don't know if you agree or not. But if you look at pregnancy itself, you can see that 3 to 15% of pregnant women versus 25% of pregnant women met the recommended physical activity guidelines. So a lot less pregnant women are active compared to those that are not pregnant. And in the US, again, a similar kind of feel there. So it is important, and by no means am I encouraging anyone to be going out and doing strenuous exercise when they're pregnant. I'm really encouraging people to keep up the same level of activity before they got pregnant as to when they are pregnant. But it seems to be, from any of the work that we have looked at, that pregnant women seem to think that they can't do a lot of exercise, they can't do their normal daily chores, they can't do those things, and they become more sedentary because they are pregnant. So I would be encouraging those people to go and get advice from midwives or qualified people as to see what exercise that they could do. And again, I thought this was an interesting quote. "You selfish cow, one of the insults hurled at me by mothers as I jogged because I'm pregnant." So that's really, I suppose, what I'm trying to say from that slide is there's a public perception of what a pregnant lady should do. And maybe we all need to encourage, I'm not sure about jogging, but maybe we all need to encourage pregnant ladies to be a little bit more active. And certainly if they're going to be jogging, they would need to seek medical advice from that. But this is all to do with public perception around what they should be doing. So really just the next couple of slides is just to try and sum up where I've come from. So pregnancy-related obesity and linked to future obesity, that's where I started from. And really there is a lot of interventions around the area of pregnancy, this is one that we're involved with in Belfast, which is looking at BMIs over 40, and they're trying to see if there's any way of getting these ladies a little bit more active. But it is an important area, and as I say, maybe technology is the best way forward to have more personalised information, whether it be groups for these ladies or individual, on more of the technology websites. So just to sum up then, the take-home messages are those who gain excess gestational weight gain and high BMI, those people are at risk. And though we should maybe be thinking about monitoring weight during pregnancy, although I know it is a controversial area and maybe it's something that we need to think about, and interventions need to be both diet and physical activity. Thank you very much. Apologies for running over. Thank you.